Hello, this is Lisa Philp. I'm the leader of Transitions Group, and it's a pleasure to be here to share some 30 years of coaching dental practices with case presentation and case acceptance. We all know that if the patient doesn't say yes with a smile on their face, agreeing to pay us more than it costs us to serve them for optimal oral health services, there is no case acceptance. So some of the pitfalls we've seen over the decades, and there's some common ones, but I'll mention just a few, as L.D. Pankey said way before his time in the 1960s, never treat a stranger in dentistry and you'll prosper. And I think with case presentation isn't an event or a transaction. It's a relationship of getting to know the patient through master interviewing skills, listening, giving them a chance to ask questions, and talking in lay terms that they can understand. You think about it, 65% of the restorative schedules generated through hygiene. And one of the big misses in the dental office is the hygiene exam transfer through prompting the doctor. So there can be a team approach for the patient to hearing not only what their diagnoses are and confirmed by a dentist, but also what are the ideal treatment plans that dentist would offer that patient while they're being involved. And the prompting is happening between the doctor and the hygienist. Obviously, the hygienist has been in the mouth and sees for a longer period of time and also sees the patient on a more frequent basis. Another pitfall in increasing your case acceptance is, patients' decisions are dynamic. They're not static. So just because last year they didn't want to hear about the crown or the implant or something outside of their insurance benefits doesn't mean we don't have a moral and ethical responsibility to revisit with them in our daily preparation. So taking the time for the dental team to review the charts of the patients coming in today and doing a check-in about previously diagnosed dentistry. So many dental practices are what I call cabinet millionaires. Without another new patient, they have millions of dollars of previously treatment plan dentistry in their charts still not complete. So it's not about sales, it's not about harassment, it's about enrollment. And it's about partnering with the patient. A patient will say yes when they trust you and they feel like you've taken the time to empathize with their individual life. And then you work with simple communication to connect it to their individual situation. In dentistry, we have so much jargon, fancy words with many syllables that the old paradigm of educate, where we do 80% of the talking in code language of PBMs, RCTs, osseointegrated, man-made, fabricated tooth roots, root canals, all of the different terms we use. We need to simplify our communication and dummy it down into words they can understand. And that's not always easy in dentistry because we're so brilliant in our left brains and we want to tell them everything. But it's not about educate. Think about case presentation in current times is the patient's doing 80% of the talking. 80% of the talking, we're doing 20%. And we're asking questions to understand where oral health fits into their life, what's important to them about their dental care. And then we are letting them know the conditions clearly in the diagnosis that are in their mouth and what the best options dentistry has to offer. The last pitfall I see is the patient saying yes in the clinical room doesn't mean they say yes at the business office on checkout. So maximizing a treatment coordinator or having a separate private area where a patient feels safe with a non-clinical person to help them talk about the time and the money involved and anyone else involved in the decisions they're making about their treatment plan that are outside their insurance benefits is extremely effective and proven to increase case acceptance in massive proportions. So I hope these pearls have helped you and look forward to more to come.